Good morning. Welcome back. COVID-19 has led to hospitals to take significant safety measures. Well, this week it is Patient Safety Awareness Week. Joining us live this morning is Dr. Corina Marcu, Associate Vice President of St. Vincent's Medical Center, with more on how the pandemic has made it safer for patients and staff. Thanks so much for joining us.
Thank you for having me. Good morning.
Good morning.
So patient safety is something we do every day. It's our culture. And it served us very well during the pandemic and our patients. All of the infection prevention protocol, the way we did the protective equipment protocol, the testing for our patients through the continuum of care as they were leaving for home or nursing home, testing of our employees to make sure that our hospital is safe. All of that was based on the fabric of our culture, which is based on patient safety.
Absolutely. And I can't imagine that it was the easiest putting all of these new safety measures into place, into effect, given the pandemic. Can you tell us about some of the challenges that you guys faced?
Most of the challenges in the beginning were related to the supplies. We didn't have enough masks. We didn't have enough protective equipment or testing material. But that soon was resolved in the pandemic early in the spring. The visitation policy was a challenge because we knew the patients and the families that wanted to be together, but it was a hard decision to make, but it's the right decision to not allow visitation for a while. But when it became safe, we allowed the families to come and visit our patients. So to me, that was one of the biggest challenges.
Yeah, and that is so important. Happy to hear that is back in place, obviously, with restrictions. I also understand that it impacted hospital-acquired infections and safety events within the Hartford healthcare system. What do you mean by that?
So it wasn't just in Hartford healthcare. It was in the state. It was in the nation, actually. Studies are showing that hospital-acquired infections related to the catheter, mainly, those were increased during the pandemic because some of the patients were very sick, and the treatments that they required, it required them to have catheters, and that makes them more prone to get infections.
Absolutely. And, it's nice to see that the vaccine rollout is continuing. People are choosing to get the vaccine. But, doctor, a lot of people are still hesitant and worried to visit the ER if they need to, or an urgent care center. So what is your advice? What is your message to those people who are still a little worried to go and receive care?
So our message has been consistent throughout the pandemic. We are safe and we are open 24/7 to take care of these patients. Do not delay seeking care. If one delays care when it's needed, it can lead to complications. It can lead to an outcome that it's not as good as it could have been if they came in time. So we're safe and we're open in urgent care and emergency room.
And that is such an important message. We have to remember to take care of ourselves. Doctor, first of all, thank you very much for joining us this morning. And obviously a big thank you for all that you have been doing and continue to do during this pandemic. We really appreciate you.
Thank you.